we continue with a wonderful euphemism, the best agers. People who, I heard Andre talk about the old athletes starting as of the 31 years or a little bit older. But to them, EMS quite obviously is highly beneficial. And your institute is, one of the leading institute that connects the EMS and senior citizens. How can their mobility, their strength, how can their everyday lives be retained at the current level by means of EMS for as long as possible? You have conducted studies, and we get the best of now, so to speak. Yeah.
Yes, indeed. Well, thank you for this kind introduction. Actually, we have more recent studies available that I would have liked to present, but the most rewarding group of customers for you is the best agers. For them, whole body EMS is ideal, and this is why I'm so surprised to see that there are no specifically tailored projects for this target group. This is included in this group, diabetics and people suffering from back pain. This is people who actually live independently. This is not a Geronto study with bed-stricken people. No, I refer to people who say, well, I want to enjoy a few more nice years, who've never exercised, that you have to take by the hand. And this is why whole body EMS is perfect for this target group. So much for my introduction. Let's talk about effectiveness now. I already mentioned the motivation, but what are the classical disorders at a higher age? Let's start with sarcopenic obesity. This is a clinical condition that is now laid down in the IDC code. This is adipositas. This is little muscle mass, lots of fat pads, not necessarily visceral fat, but also the intramuscular fat or this intravisceral fat accumulation. And this is, of course, high risk for older age people, not only because of the cardiometabolic elements, the inflammations associated, but it can even be lethal. People cannot actually walk up their stairs any longer, so this kills independence. Physical exercise, of course, also helps, no doubt about it. But for many older people, this is no longer an option. They have either never exercised, and they tell you, well, I have not exercised for 50 years and I will not start doing it now. Or they're unable to exercise because they have ankle problems, knee joint problems, hip joint problems. So again, EMS is perfect for them. A very close ratio, 1:1, 1:2. Like in personal training. And this also applies to competition or competitive sportsmen. We allow the power to do the job for us. So 90% are arbitrary activation. And there's a certain amplitude for functionality. Well, here again, in summary, it actually saves the joints, it can be personalized, and it is time efficient. This is even more efficient than HIIT training. This is full exertion training, which we don't want. And again, we're faster with whole body EMS. Again, I want to be perfectly clear about it. It is the perfect method, especially for older people. Young people can exercise, do strength training, HIIT training, but older people don't have this option. They often depend on whole body EMS, and thank God there is EMS for this age group. It is so obvious to me that I'm really strange. I find it strange to see that there are no specific application projects. Well, this is a market niche. So what are the disorders in old age? Sarcopenia, but also depressions, back pain, osteoporosis. So this is then a higher risk of fractures, then the frequency and the seriousness of fractures when I fall. Then adipose patients, obesity, their problem is not a higher BMI. They simply have too little muscle mass. Then all of these blood fat disorders, then the high blood pressure and the diabetes type 2 and COPD, for instance. The cardiometabolic disorders, as I said before, high blood fat and the high blood pressure. This can be really treated and influenced very well with EMS, whole body EMS. Muscles are, of course, our target organs because muscles are organs. They want to be nourished, they want to be have their blood circulation, and muscles respond quickly. So we would attack and address all of the risk factors. I'll skip the depression, although I have results for this. Is it really the close interaction between the trainer and the person being trained that also mitigates depression, or is it EMS itself? I'll stick to the hard parameters, which is muscle mass and body fat, bone density, the cardiometabolic magnitudes or the metabolic syndrome. This is a risk cluster where we're looking at visceral blood fat plus ADLC, the good cholesterol, and the triglycerides and the glucose. So this is a cluster of risks in the range of cardiometabolic diseases or disorders. And I would also like to mention the hazard potential, the risk potential. And what do we know for sure in EMS? Is it dangerous? Is it not dangerous? Have we seen any occurrences? We've made so many studies. Other study groups have completed so many studies. And we're actually addressing this to people aged 70 and older, which is not old age yet. You all have parents aged 70, 80, and even older. All of my ancestors turned 90 and older, but I want to live and experience the last 10 years of my life without being confined to a senior citizen's home or a nursing care home. So I'm not only interested in whole body EMS as such, but I also focus on protein supplements because muscle mass protein is related to muscle buildup and functionality. I will actually walk you, or rather race you through these charts. This is the classical studio protocol. So to ensure that you can actually use the results and break them down for your own studios. Nutrition, this is a very low protein supplement, 0.3 grams per kilogram of body weight. This is really a very low. This is a recommendation for older people. Apart from that, it is, of course, difficult to achieve muscle buildup. We want muscle mass to grow. Then we have the sarcopenia. This is always a mixture of between loss of muscle mass and loss of function. This is always included in the new definition. Muscle mass, but also function. It is not as strongly correlated as we might think. Then the body fat measurement, that's easy thanks to Siemens, and the metabolic syndrome. So these were the endpoints in this relatively old study dating back to 5 or 6 years. And this is the Z score. That's hard to describe. It's a conglomerate of muscle mass changes and the functional changes. The negative changes are positive in the Z score. Remember this. So this is whole body EMS, an excellent change. 3 stars means the highly significant. Interestingly enough, no better results in the whole body EMS group plus protein. And the third group was a control in group, completely inactive without protein. So in this axis, there was hardly any negative change. So they worsened. And when you compare the 3 groups, then there is a huge difference between the whole body EMS group and the control group. The muscle mass buildup, very satisfactory in the area of whole body EMS, very clear, striking over just 6 months. There's no additional effect achieved by protein supplements, and the control group lost muscle mass. The same applied to gait speed. There is a set gait speed, and there's a gait speed of death. If you're slower than 0.8 meters per second, then you will probably die the following year. The functionality is so low, your fitness is so poor that you won't survive another year. I forgot to mention this data that are based or is based on a very low level of intensity. So this is nowhere near full exertion. It's a very soft training. And this works so fine for muscle mass and muscle buildup and grip strength. When you look at the body fat contents, then the results are not so striking. This was a surprise for us. We thought low intensity training once a week, we won't see big effects on the muscle buildup and functionality. No, wrong. Here, the body fat did not respond that well, or the abdominal fat. There's a little difference with the naked eye, but the little stars are missing. So this is not a significant result. Very clearly so. Then this is the strength increase. We do a leg press exercise to check on the results. And in these groups, we saw an improvement of 20 to 25, which was a very good value in such a high age group. Despite the low intensity and the low training frequency, just once a week. So, first summary, even with a low-level training, only once a week, and a low intensity, you can achieve excellent muscle buildup and muscle functionality improvement. But you won't actually impact body fat too much. This is the cardiometabolic syndrome. Here, when you apply whole body EMS, you actually obtain better effects when you also add protein supplements. Both EMS treatment with and without protein, the results are a lot better than with the control group. You would think that visceral fat is really the root of all of the disorders, blood fat, but here we have a very little reduction, a small reduction of visceral fat, and nevertheless, the effects on high blood pressure have been very, very positive. This is a reduction of 10%. Reduce the blood pressure of 10%. This is almost as good as a drug. I was very happy with these results. I was only unhappy with the visceral fat. And we actually love to train 1.5 times a week, which means once on every Tuesday and every second Friday. Okay, what is the summary? So we have relatively good effects on the muscle mass, muscle buildup, and functionality, but a little impact only on obesity magnitudes. Administering little protein seems to not work too well with this age group. So there seems to be a kind of protein resistance. In the next study, but there were no negative effects. Protein plus EMS, you might think, well, maybe there's some problem with the kidneys. Nothing. All of the kidney parameters were great. So this is a very good sign, especially in this vulnerable age group. Okay, this means suboptimal protocol. So more intensity, higher intensity would better, and we would have to add more proteins. So this is the second study called FRIENDSO, and we're from the region of Frankenland. And with this study, we focused on the body composition. The first study focused on women, and here we focused on men. And we increased the frequency, and we were on a scale of 6 to 7 out of 10. And we always asked the trained subjects, and they felt it was pretty hard. Then same training, same volume, same exercise, 1.5 instead of 1, and more protein supplements, 1.8 grams per kilogram. This is far off the bodybuilders. I mean, 1.8 grams per kilogram of body weight, well, it is more than the recommended amount. Then whey-based, this is of course not so important for you. And always add vitamin D. Vitamin D is an important supplement for old people, for older people, for everyone. It's a steroid hormone when it's biologically active. It's a hormone. And it really makes sense to work together or cooperate with diet specialists when you really want to focus on an older group of customers. So both ideal nutrition in the trained group and in the control group. This is the intervention phase, as I said, the way we usually do it, 1.5 times a week over a total period of 14 weeks. And these are the results. Skeletal muscle mass index. This is, of course, adjusted for height. And since these people don't grow anymore, that's easy to read. People who only take protein, they really had a sizable muscle buildup without training because they have such a huge deficit. I admit it would have been great to have an EMS group only, but we didn't have it. And this is the control group. So muscle buildup, yes, with whole body EMS, with a protein, and the functional parameters like grip strength or gait speed also improved. A lower increase in the leg strength, only 10%. This was a pre-trained group of persons. But let's dig a little deeper, because we do not only do the classical measurement of muscle mass, we also look at the muscle density at the thigh. This is the fat intrusions, for instance. What happens with those when you do EMS? And this is spectacular when you focus on this fat-free cross-sectional muscle volume of the mid-thigh. So this is the CSA. And you do a spiral MRT. This is like a spiraling layers that you can see. And here you can see a 9% increase of fat-free mass. So not only the cross-sectional area has increased, but also the fat-free muscle mass has increased. And this is exactly what we want to see. Not only the fat thigh, but we want more fat-free mass. The colleagues always said, well, in the depth, we don't have any fat. We can use some ultrasound to see this. But this was really very revealing to see that this training really works all the way to the depth. Then obesity, yes. In more intensive training, what happens? Like in all of the other old studies, you have a high reduction of body fat as you have an increase in muscle buildup. So these are the standard results, and they are also reflected in older people. So if you increase the frequency just a little, and if you add a few more proteins, then you can see the difference. The BMI, of course, doesn't change because the fat mass, decreases, but the muscle mass has increased. So obviously, it also works for obesity, for obese patients. People or men did not have such a poor functional level as the ladies. Quite interesting to note. The ladies in the previous study came on their own. With men, it was completely the different way around. The women actually keep their men fit. And women are often on their own, and there's nobody left to keep them fit because men die earlier. I think that protein supplement, whey protein added to the daily diet between 1.7 and 1.8 grams per kilogram of body weight produce the best results in combination with whole body EMS training. Then you not only build up muscle, you do not only increase the muscle functionality, but you also produce a positive impact on cardiometabolic magnitudes. And this is our standard protocol for the older collective, high protein, whey-based nutritional supplement, plus whole body EMS. This is a regional problem. When you ask people, did you like it? And they say, pasture was okay. They hardly get enthused about anything. So about wellness, it is difficult to find this out. But in the area of depression, we actually find that EMS, whole body EMS helps. But we do not know whether it is only due to the close cooperation between the instructor and the trained subject, or whether it is the EMS as such. We focus on the imaging systems to get facts. Again, there were no negative effects produced by whole body EMS training. There were no negative effects by the higher protein supplements. And this is what the doctors are afraid of. And we're still at the low level of protein admission. Add a little more protein. It was 40 or 50 grams of protein powder, which is affordable, and you don't even have to leave your home. And then add 1.5 EMS. I mean, this is really easy for your health. This is why I think that this is really valuable for older people. It is the group that benefits most from whole body EMS. But I also wanted to talk about osteoporosis. You always think that there is this close muscle-bone interaction, and we thought that the EMS training would be so promising because muscles are actually fixed to the bones, and they actually tear the bones, and this helps the density. So we actually included people in our study that have an osteoporosis problems, trained with them 1.5 times a week, 20 minutes per week. It's an older study, intermittent program, 4x4, classically as you do it in your studio. And let's look at the bone density. It was not bad. The result was not bad. but it was not as good as we had hoped it to be. When you actually look at or remember the muscle buildup improvement, here the improvement is 0.5. So and it was 50 women per group, so it was not a small group. We didn't have a problem in finding people. And I don't think that we made a mistake. It does help bone density. It actually prevents falls and fractures, but it is not as effective as we would have liked it to be. We are actually end up in the area of whole body vibration to improve bone density, the power plate. I mean, you know this. The power plates are primarily used for improving bone density. And we've reached the same level with whole body EMS, but we have not exceeded this level, especially here around the hip. We did not see as good an effect as we would have liked to see, or in the lumbar spine, the effects were not the desired ones. We had expected more. We were really a little disappointed. I think it is really valuable to also highlight the limits to EMS applications. When you include jumping into the protocol, jumping up from the squats, then this looks completely different. There is an interaction between the muscles and the bones, and you can also improve the results here when you simply adjust the exercises. Again, the good effects on muscle mass, on body fat. I don't want to repeat myself here. This all worked out fine, but we were disappointed about the bone density. Despite the high strain on the muscles and despite the excellent effects on the muscle mass and functionality, the effects on the bone density were suboptimal. Again, when you have such a group of trained subjects, then actually change the exercises, increase jumping inside the bone. You can adjust it, no problem, through the exercises as such. Then the metabolic syndrome. There's so many things I wanted to tell you today. This was men age 65 plus with an obesity problem and the metabolic syndrome. And I wanted to briefly show what happens to them. This is not the classical EMS application, the metabolic syndrome, but why not look beyond your backyard? This is the prevalence of the MET syndrome. And here you can see a comparison between EMS and the vibration-only group. We wanted to have a control group that where the people don't feel treated unfair. And this is why we said, okay, in our control group, we will have the vibration training. And I explained to the people we have visceral fat and glucose, high glucose, resting or fasting glucose is high, blood high pressure, low HDLC and high triglycerides. And from the 5 parameters, you have to comply with 2, and then you have a metabolic syndrome. And we actually resorbed one of these factors, and this is beautiful data. And the trigger is always okay. You have the reduction in abdominal fat, and this is the most important parameter that actually impacts high blood pressure, etc., and all of the other factors. And this is why you're on the right track when you do EMS training. And here you can see the reduction in abdominal body fat. And this impacts all of the other risk factors. The trigger is the reduction of the abdominal fat. and thereby you can actually improve all of the cardiometabolic disorders. If you do away with your visceral fat, your abdominal fat, then you will positively impact all of the other parameters as well. Back. We also did a study involving back, but you've heard so much about back pain. Should we talk about it? What about the time? Do we have time to talk about back pain? No, actually not. No. No? No, look at more interesting things. Yeah, we're through with back pain. We have enough evidence showing that whole body EMS actually positively impacts back pain. We know this now. Dr. Wegner has presented his study. We have presented the third study by now with almost 200 trained subjects. Is there one nice chart? No, that's not the one. No. This is an early study showing the effects by whole body EMS. All three groups underwent the back courses, vibration and EMS, and all of them actually affected back pain. But the most time-efficient program was whole-body EMS. So for the patient who's in a hurry and suffers from back pain, EMS is the best intervention. Although, of course, you have to be critical about this. EMS studies are not everywhere. If you have transport problems, that's another story. That was a nice study, allowing us to say, well, other routines can also help. But when you summarize the evidence, the current evidence, what do we know for sure? What has really been scientifically proven? Muscle mass, muscle density, highly effective, no doubt about it. When you train properly, then you can use abdominal fat and body fat, and the isometric strength. This is also improved because we actually train with low amplitudes, but even dynamically, especially for women, you can actually increase the strength by up to 40%, 35%. And we have really fantastic evidence for back pain. Then power, there is bounce, there is latest data. Of course, we did not focus on this in our groups, and this is why we don't have so much evidence, like for discus throwers. Then the cardiometabolic risk factors, we can influence these very well, but more moderately than in terms of in comparison with muscle buildup. Bone density and fall risk factors, gait speed, these were not so well impacted. But when you actually reduce the risks for falling, then this is really important. Breaking these parts of the hip really kill independence. And 70% of these fractures are caused by falls, by walking slowly, and people simply fall to the side. And when I can actually improve the balance for those people, then, of course, I also help them with depressions, because very often these people are simply afraid of falling. We have to say that there's little evidence for the effectiveness of the functional endurance. Well, we have not tested this properly. I run for 12 minutes before. How many meters do I make? Then I do an EMS training and then run again after 12 weeks. Is there any improvement? But this is what interests me. I am not interested in my lactate levels. I'm not interested in that at all. I simply want to know whether I run better. And there's hardly any evidence. So local EMS application does not help here either. There's one study available from Verschuren. Well, the name is of no importance. They actually train 5 times a week, for 240 minutes. But this is not our way we apply EMS. We want to be time efficient. Then there's no effectivity for mental performance, for mental health, simply because we have not tried to test it. It's not that we have run any tests and did not come up with nice results. We've simply not addressed it yet. So there is lots of room for new studies. And these are all studies in the health-oriented area. There are 3 new studies that were added for cancer, palliative medicine. We are reporting regularly, and I think that the colleagues are also reporting on adverse effects, the undesirable effects. This is part and parcel of medical ethics, but we have not seen any undesirable side effects. We've not seen any of these reported, and our experience was exactly the same, even over months of application. We've monitored the renal factors, the parameters, and we have not seen any undesirable side effects because we regulate it very strictly. I think this is an important point. In the previous session, you already heard that bad coverage can actually kill us, can put a damper on all of our business, and this is why I was not so fond about hearing diabetic patients. In the Dean, we said, don't use EMS for diabetic patients. It's a critical collective. Jens, you know it. We sat at the round table and said, one says yes, the other say no. Everyone would say, I can do it, but you don't have the top skilled people at every studio. And it's a counterindication. So it's better to exclude diabetics from the EMS training at studios where you don't have skilled employees. So I don't want to see those times back. So far, so good. Older people, whole body EMS is the perfect solution for older people who don't want to do strength training or can't do endurance training. This is the ideal training method. And if you combine it with a dietitian, a nutrition expert, and you add vitamin D and proteins, this is all supplements. It doesn't take a doctor to administer supplements. Then you can do so much for older people. And this is really the most loyal group of customers to my mind. I can keep people fit for longer. This is far more beneficial than actually speeding a person up by 1 or 2 seconds. I'm sure you will enjoy this audience a lot more. So this is my food for thought. Specialize more in these customers. It is a very grateful job for you, very rewarding. Okay, yeah. Why don't we have specific offers for such a group that is so rewarding? And this is a big niche. And this is important to say as well. This is my disclaimer. I don't need one because there is no conflict of interests with me. There's no technology, no training tool is fit for all. You have to find the right people for it. Well, thanks very much for your attention, and would like to thank the following speakers whose time I've stolen. And I guess questions outside during the coffee break. What do you think, Mrs. Koenig?
Yes. So any questions where you say, well, this is so relevant that it applies to everybody here in the audience, or do you have specific questions you could also ask personally outside? Okay, nobody will raise their hands and say, yes, okay. So Professor Kemmler will be available outside. Anybody, well, who would like to speak to him, well, we'll do so. Okay, well, that was plenty of information. I think it was too much again. Well, we received a lot of input before, in particular focusing on back pain, and so this age component is a new aspect. So thank you very much.